Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over the findings or the EKG criteria that would indicate that our patient has right ventricular hypertrophy or RVH. So first, if our right ventricle must work harder against more pressure or it has to accommodate more volume, then our right ventricle will grow bigger and stronger to keep up with this excessive workload. So the main criteria for RVH is that in the V1 and V2 leads, remember these are the V1 and V2 leads, if the R wave is bigger than the S wave, then we say that patient may have right ventricular hypertrophy. Remember, why are we looking at the V1 and V2? Well, we know that the V1 and V2 leads look just a little bit more at the right ventricle. This is why we use V1 and V2 or the complexes in V1 and V2 to check if right ventricular hypertrophy is present. So if the R wave, shown here in light blue, which represents ventricular depolarization, is bigger than the S wave, then we say that it is likely that the patient has RVH. Remember, more muscle equals more amplitude, equals more electricity. Now, remember that this finding can also indicate other pathologies like right bundle branch block, or it can be present in younger or older adults, in Wolff-Parkinson-White syndrome, type A, or in a posterior wall MI. But RVH is far more likely. We must remember to always take into account the patient's current presentation and clinical history, which will give us clues as to what to look for in the EKG. So if our patient has a history of pulmonary hypertension and they have an R wave in their V2 that is greater than their S wave in V2, then we would say that this patient may likely have right ventricular hypertrophy. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.